Yes. And I'm going to digress from what you want me to speak because I will never speak what you want me to speak. I'll speak my own, I'll speak my mind, and I'll speak my heart. Right, Chitra? We come from that same place called Bihar, and we speak the truth honestly and in person.
Partha, is there any other way of speaking the truth but honestly? I'm just asking.
Well, just to re-emphasize, Duel, yes. The first and the most important thing, Dr. Chitra, when I just entered the room, I stood back. I had come prepared to tell you so many things. But my mind went back to the year of 1984. And Chitra, can you imagine 2 plats running all the time, reading, and that same Chitra, and we envied her. She was getting married to a guy from RPC. My God. But let me also tell you, she had her feet grounded, and she was that same Chitra, what she is today even, when she goes in for this particular walk the talk session. She's come all prepared, and that's what Chitra is. All prepared every time. But let me tell you, Chitra, I think, I will digress and I will say Chitra as my Eskimo. First, where are we? Chitra as my Eskimo. So if Chitra was my Eskimo and Doel wanted me to sell 1,000 kg ice cream to Chitra, what do I do? So I come and say that this Mohan Rajan has opened centers all over the place. He's even come to Calcutta, and he started a LASIK center and a Smile center right opposite Tri Netralaya. And I'm nearly going broke, out of business. Chitra, I am giving up refractive surgery. Chitra, I have to, sell ice cream now. And that ice cream is not too much. It's just about 1,000 kg ice cream, Chitra. Can you please take it home? I know you have a very supportive husband. You spoke about them, Shreyash, Shrishti, and all of them. I'm sure they will allow 1,000 kg ice cream. And it will cost just about, 1 CR. Not much. So will you buy it, please? No! Wow. So she says no. And she says no to a childhood friend of hers. And please remember, when you're going into election polls, she said no. She said no to me, right? And is that another facet that you have, Dr. Chitra? No, I will understand that. So now I'm going to sell my ice cream to you for sure. Why? So Chitra, you give me that bag of yours, please. Wonderful. Now that bag doesn't contain 1 CR at all, but it contains 1,000 small cards that she's distributing to one and everybody. So I take that burden of Dr. Chitra on me. I am going to put those 1,000 cards in the most uplifted pockets like Dr. Sangwan's, Dr. Bansal's, Dr. Prashant Bavankule, and I'm going to ask you, take that 1,000 kg of ice cream. Done. So I've sold my ice cream to the Eskimo. The next Eskimo is not so difficult. And the next Eskimo is, where are we? Not so difficult at all. He said, dare to bear. Dare to bear. Srinivas, I don't know what you wanted to tell everyone, dare to bear. Okay, you told, but I didn't hear what you told. So when I saw that, 7 app with that little chota sa wo, so I said, ki dare to bear ka kya hai? No, Srinivas, why are you laughing? No, don't laugh. See, please, it's not a joke at all. Prashant Bavankule, take that smile off your face. Now, ladies and gentlemen, what's there to bear? What's there in it? Think of the day we were all born. Think of that time when our mothers held us in her arms. And God wanted us to be daring and bearing. So you can take off that little triangle and pair. It's all right. It's we humans who think otherwise. We think of all naughty things and dirty things. But God created us to be this. So will you bear? Why? My ice cream is sold to my Eskimo. This is the tough one. Something's happened there. Something's happened there. Namrata, you are my Eskimo. You are my Eskimo. I know Subhash sir so well, just like I know Ramurthy sir so well. Will you buy 1,000 kg of ice cream? I'm out of business. All the Mohan Rajans and the Maipal Sachdevs, everywhere, sharp sights, everybody is coming to Kolkata. I'm out of business. And there my poor wife is sitting all alone and just imagining that, yes, I'll be able to sell 4,000 kgs of ice cream for 1 CR each. So will you buy 1,000 kg of... She does not have the money to buy it. She has to ask Subhash sir. I will get her to change that. Dr. Namrata. Now I go on to a particular conversation that I had this morning. Dr. Namrata, you'll have to hear me. Keep your presentation aside for some time. So this morning, I received a call from Gary. And who is Gary? Now, Gary is from Massachusetts University. Gary has won the Nobel Prize 2024 for the mRNA, the micro mRNA. And Gary said, Dr. Biswas, is that you on the line? And I said, yes, sir. This is Gary. I said, who, sir? I'm speaking from Massachusetts University, and I want a favor from you. Would you know Professor Namrata Sharma? I said, yes, sir, I do know her. So, the next part of our project of micro mRNA is going to be on limbal stem cell grafts and SLET and CLET. Now, I know the pioneers...
Partha will have to wrap up, please.
One more minute.
I'm being charged with bias towards my statement.
One more minute.
Half a minute.
And, okay, half a minute. And he said that there are two people whom I want to be connected with, Professor Sangwan and Professor Namrata Sharma. They are doing a lot of work on SLET. And I feel that the mRNA is going to be a very important product in the pipeline if they can have this study done here in India, in New Delhi, because I believe both Sangwan and Namrata Sharma are in New Delhi. I said, so why are you asking me? And he said, you are the president of AIOS. So if you give a sanction, the academy and the AIOS will go into partnership, and Professor Namrata Sharma can be the PI as well. Professor Namrata, can you take 1,000 kg of ice cream from me?
Yes.
अरे बोलो यार, कुछ तो दिल से बोलो हाँ, 1,000 क्या 5,000 kg भी ले लेंगे. So
Partha, we'll wrap up now.
Thank you very much.
Okay.
Thank you, everyone. Thank you
yeah.
for this wonderful opportunity, Dr. Doyle.
But before you go, Partha, I have to say something. You know, you reminded me of Trump today. So much. You see, the first time that Trump came into office, he stayed on track. You know, he behaved like a president. He was so friendly with India, he stayed on track. Second time he's come, he's completely off track because he knows there's no chance that he'll come back again. Same with Partha. The first time he did walk the talk, if any of you have seen it, it's out there. You'll see he's literally spoken on how to counsel a patient, how to sell ice cream to a patient. That is what he was supposed to talk about. Second time he came for walk the talk, and he knows that in March he will anyway not be president. Like Trump, it's his last term, so talk anything. And I am actually confused, Partha, what you actually sold, because believe me, you've sold nothing to me. I don't know any of the audience. Did you buy anything of what he said? No. Pardon? He sold you naked, that's okay. But I don't know if the audience bought you. Any of the audience bought Srinivas naked? No. So, we really don't know. But I'm coming to the audience. Any one of you who can share, at least that's coming back. And my two other speakers, I will not even dare to say what you're going to speak on, because three of my speakers literally digressed from what they had to talk about. So I'm not going to introduce what you're going to say. But coming back to counseling, let's go with Anagha. Anagha, when you're counseling a patient, tell me something. How much does honesty count? How much are you honest? And let's be honest about that. Do you tell the patient everything? Do you ever tell the patient that because of the surgery, he might even go blind?
So, ma'am, let's see two scenarios. Okay, let's see a cataract patient or a refractive patient. For example, a refractive patient, if he says, madam, will my number ever come back? So then I tell him, yes, there could be a 5% chance that you might get some number in the next few years. And definitely at 40, you will need near glasses.
Okay, and what about
that
the
is number
cataract
one.
case?
Sorry?
Cataract case?
Yes, for a cataract case, I first talk to the patient regarding what his kind of work life is, whether he desires spectacle independence, and if he chooses a multifocal, for example, which is the most premium lens.
You're not coming to the point. Do you ever tell any of your patients that he might go blind when you're counseling him? I'm come to the point. We all do all of that, Anagha.
I tell him that yes, there could be complication, especially if it's a high-risk case. I tell him that there is a possibility of loss of vision. For example, if it's a mature cataract, and we cannot see, then definitely I say that because we cannot see the retina and the
Do
optic
you tell the
nerve,
patient that they can be endophthalmitis and you might have to do an evisceration, and then the 6/18 that he had might become a PL positive or a PL negative?
we tell him...
Yes, no.
I don't mention the name endophthalmitis.
Okay, fine. Amit, I'm going to ask you another question. Counseling, how important is it to dress well, to be charming, to be young, to be friendly? Especially if the your patient is a female. Yes, you, Amit. Kavita is not here, so speak your heart.
She's sitting
Oh,
there.
she's here. Okay. Kavita, put your hands on your ears.
So dressing smart doesn't make a difference. I
Really?
usually wear a jeans and a t-shirt for my work.
So
And
who said that's not smart?
Yeah, so jeans and a t-shirt, and I am a glaucoma surgeon. So most of the patients who come to me, they have a tubular vision, so they can only see my face.
And you keep that shiny, right?
Yeah. So coming to the question whether you can go blind, yeah, I do tell my patients if they have a 0.9 advanced cupping, and chances of snuffer phenomenon is always there when I do a glaucoma surgery. But I do tell them that there are chances that out of 1,000, 3-4 people might go blind. You might be a victim of that, but then there's no choice. You have come at a very advanced stage, and I explain them honestly. And trust me, till now I had only one patient
I
of
think on the
snuff
whole,
off.
you know, Amit, there's a very fine line between being honest with the patient and, you know, getting your patient, because I don't think all of us are totally honest, because if we were totally honest, I doubt any of us
You
would get
asked
any
me why-
patients.
you asked me
so
my
there is a
views.
fine line there.
You asked
but
me my
yes,